Thank you, Nampang. This is Mahesh, and good morning to all of you. It's good morning to all of you, and thank you, and I thank Kitty Watt and also Anjali for inviting me to speak at this conference. I was hoping to visit Thailand, but hopefully next time. There will be next time soon. What I want to talk about is role of medical physicists in the clinic during COVID-19 pandemic. I joined the meeting an hour ago, and heard all the talk from the previous speakers on the activity of the COVID. Very encouraging, and some of it will be repetition. Here are my disclosures. So what I want to talk about is, like, you have seen these maps. This is the global pandemic. This is as of today. Johns Hopkins University has gained wide name because of these data sources being developed here. And as of today, it's about 64 million people are infected with the pandemic, and about 1.5 million people are dead already. It's really, in the U.S., it's getting really serious situation here. Just yesterday itself, there are more than 3,000 people passed away because of the COVID. And there are a number of factors which has played to this one, including politics. So what I want to talk here is, like, I'm not going to repeat the same thing, but I want to stress on a couple of things which is very common. First of all, medical physics practice, how it's been impacted is, it has transferred all aspects of society, including our medical physics practice. In fact, when in the US, it started around in March, when there was a complete shutdown or lockdown occurred, and we were all asked to work from home, and that's called like work from home or remote working was encouraged for all the services in the beginning. In our Johns Hopkins Hospital, except for the essential workers, everybody were asked to work from home, because it is really and a lot of the elective surgeries, everything was cancelled like any other place. All hands on deck were focused on how to address and take care of the COVID patient. So because of this, there are a number of challenges which has to be addressed initially. So we can look at two ways. One is the challenges of how the role of medical physicists in the clinical, in the educational area, and also in the research areas. I'm also active in the American Association of Physicists in Medicine. We, in the beginning, started up a web page with a lot of resources, and I would encourage anybody to check out this web link, aocmp.org/COVID-19. It has a lot of useful materials and also very active links for all different aspects related to COVID. So, I'm kind of looking at it two different ways. I'm a diagnostic medical physicist. So, from the point of role of medical physicists in radiation oncology, I know majority of you are practicing in radiation oncology. One can look at the role of medical physicists in two ways. One is the active presence inside, and the other one is work from home. As Arun already mentioned, that the on-site presence is pretty much critical for brachytherapy procedures or stereotactic radiosurgery, where medical physicist has to be in the clinic and are essential workers brought in, and also for doing all the quality control prior to any treatment. These can be broadly grouped into on-site presence. Whereas work from home, a lot of things can be achieved from work from home, but the balancing is a challenge, including doing the chart reviews can be done remotely, which was done here, and I think like in any other places. Of course, any type of teaching, we adapted towards doing remotely, and even now we continue to do the teaching. As the previous speakers mentioned, how they are developed e-learning process, we are doing the same thing with teaching the physicians, residents, and the radiation oncologists. And at Hopkins, it was required that all the researchers, if they had not had to come to the lab, they had to do it remotely. Only from May onwards, they've been allowed to come in a very staggered way. There is also policy and procedures of who can come to the lab, and what's the distance, the social distancing has to be maintained, and so forth. Work from home also can be looked into for like looking at all the regulatory compliance and also learning new things. What about imaging and nuclear medicine? Compared to the radiation oncology, the medical physicists in imaging, a lot of the activities can be done from home, and that can pose both the advantage and disadvantage, because if we do too much from home, we can be completely removed from the scene. The same thing with the nuclear medicine, but there are a couple of online on-site requirement is important, especially for quality assurance activities. What we saw in our hospital is when we were asked to completely move out of the hospital, like for the first 2-3 months, a lot of the regulatory required testing has to be postponed. Accreditation required QC has to be postponed. And that kind of backlogged now after we started coming back to the clinic, and that in addition to our regular work, this testing frequency has increased because of this backlogging. Regarding work from home, imaging physicists can do and respond to radiation dose and risk queries that can be done remotely, which is anyway done on a phone calls or a Zoom calls. Monitoring radiation safety of the staff again can be done remotely. Educating both the medical physicist, technologist, or the physicians are all done from home, like the Zoom call, like any of you are involved, and doing any type of research support. There are a number of challenges for medical physicists working from home. First and foremost is isolation can become a serious issue for the physicist. Plus, medical physicists, a lot of the time we work behind the scene, and we are completely absent means that we can lose the physical contacts, and the collaborative efforts we do with our physicians is lost. So, the loss of in-person interaction is a challenge for work from home for medical physicists, especially for immediate resolution of questions and complexity associated with patient care can only be done in-person interaction. That also, another thing is like in-person interactions also increase, facilitate more efficient workflow. It also develop good relationship with the physician colleagues, trust and respect from colleagues. These are very much challenges for us to face during this COVID time. Plus, if you're at home, there's also greater distraction, especially younger medical physicists. They have issues with respect to the child care, family-related issues, and also sometimes the technological limitations can also include, such as internet connections or web browsing, security, and all those things can also pose a lot of questions. So let me give you some things what we at Hopkins have done. The reason I'm telling you is like one of the things which we have been involved at Hopkins is the following. At Johns Hopkins Hospital, we have more than 25 CT scanners on campus. So we have dedicated CT scanners, about 2 scanners.